Welcome. If you're a doctor aiming to practice in Australia, you have probably heard about the AMC exams. These are the gateways for international medical graduates who want to wear the white coat down under. In this video, we'll walk you through everything you need to know about the AMC Part 1 and Part 2. We'll break down their structure, timeline, cost, preparation strategies, and what life looks like after you pass. So sit back, relax, and get ready. This is your complete guide to becoming a doctor in Australia. Let's start with the basics. Why are there two exams? The Australian Medical Council or AMC doesn't just want to test what you know. They want to make sure you can apply that knowledge safely and effectively in real-life Australian healthcare setting. That's why the exams are split into two parts. AMC Part 1 is all about clinical reasoning, how well you can apply your medical knowledge, think fast, and solve problems. AMC Part 2, on the other hand, tests how you perform. Can you handle real patients? Can you communicate clearly? Can you make decisions on the spot? These are the skills that matter when lives are on the line. Before you even think about booking your exam, there are a few steps to complete. First, your medical degree must come from a university listed in the World Directory of Medical Schools and be eligible for ECFMG for your graduation year. All your documents must be verified through EPIC or ECFMG. This verification process can take anywhere from 2 to 6 weeks. Once that's done, you'll register on the AMC portal, upload your documents and pay around 642 Australian dollars. After that, you'll receive your AMC candidate number, but only once your documentation is cleared. And don't forget, you'll need proof of English proficiency to progress further in the process. Now let's dive into the AMC Part 1, the Multiple Choice Questions Exam or MCQ. This is a computer-based test held at person view centers all over the world. It's a single sitting that lasts 3.5 hours. You'll be presented with 150 multiple choice questions, but only 120 will be scored. The remaining 30 are pilot questions being tested for future use. The exam uses computer adaptive testing, which means the difficulty adjusts based on your performance. One important rule: once you answer a question, you can't go back. There's no backtracking. You'll receive a score between 0 and 500. Your results will be emailed and also be available on the AMC portal. You'll even get a detailed feedback to help you understand your performance. The exam content is based on the Australian curriculum framework for intern-level doctors. Here's how it breaks down. 30% is adult medicine, 20% is general surgery, and the rest, pediatrics, OBGYN, psychiatry, and public health, law and ethics, are all 12.5% each. You can take the exam up to 12 times a year, and it's held globally. Booking usually closes about 3 weeks before the test date. The current fee for the AMC Part 1 is 2,920 Australian dollars. Now let's talk preparation. You'll need a solid 3 to 6 months of focused study. Recommended sources include AMC Handbook of MCQs, the Anthology of Australian Medicine, Tallies and O'Connor's, Muta's, Therapeutic Guidelines, and popular MCQ banks like ACEQ Bank, AMC Wise, and Emboss. Simulate the real test experience. Set a timer, mix new and old questions, review your mistakes, and track your scores. Don't forget to use the official AMC app. Avoid common mistakes like skipping ethics, cramming rare diseases, or booking the test too early without enough practice. Now let's talk about Part 2, the clinical exam. An objective structured clinical examination. You'll go through 16 clinical stations and 4 rest stations, so 20 stations in total. Each station gives you 2 minutes to read the case outside the room and then 8 minutes inside to perform. Whether that's taking history, doing an exam, counseling a patient, or managing a clinical situation. This exam tests multiple domains all at once: your clinical reasoning, professionalism, patient interaction, and communication. These disciplines covered include everything from internal medicine and surgery to pediatrics, women's health, psychiatry, emergency medicine, and ethics. You need to pass at least 9 out of 14 scored stations to clear the exam. 2 of the stations are pilot stations and don't count towards your score. Scoring is done using structured checklists and global ratings. If you make a serious safety or professionalism error, that can lead to immediate failure. Now, where can you take it? Part 2 is available in person in Melbourne and select international locations. Some stations can also be taken online but follow the same format. The fee for the in-person exam is 3,000 Australian dollars and the online version is 3,400 Australian dollars. If you were charged more earlier, don't worry, automatic refunds are issued. Exam slots fill up fast, so plan 3 to 6 months in advance. And just like Part 1, preparation is critical. Join study groups, do role plays, switch roles as examiner, patient, and candidate, record yourself and review. Use AMC clinical trials exams if available, and don't ignore soft skills like communication, confidence, and understanding the Australian healthcare system. It matters more than you think. There is also an alternative to Part 2. It's called Workplace Based Assessment or WBA. This is a 6 to 12 months hospital based program where you're evaluated by supervisors through direct observations and discussions. It's immersive but limited in availability and expensive, usually 10,000 to 12,000 Australian dollars. It's paid directly to the hospital, not AMC. Now, once you pass both AMC exams, you receive the AMC certificate. This certificate allows you to apply for limited registration, which lets you work in supervised hospitals positions. You'll complete at least 47 weeks of supervised practice across core specialties like medicine, surgery, emergency, and more. After that, and once you meet all professional and language standards, you can apply for general registration and begin working independently as a doctor in Australia. And that's it for the video, guys. I hope you liked it and found it informative. And if you did, please press that like button and subscribe to our channel for more such content ahead. If you have any doubts regarding the AMC exam, please list them on the comments below. We'll be very happy to answer. I'll be seeing you in the next one. Till then, bye bye.